Okay, basically we are a screening practice, and we look at healthy women yearly to detect breast cancer. So we do mammograms on an annual basis and go through the mammograms, and if there's any changes that might suggest that there's problems. In the past, about 4 years ago, we still used 2D mammograms. About 5-6 years ago, it was just normal films, maybe 10 years ago, and it's changed to digital. And the digital era gave us an opportunity to actually go 3D. So we do a whole range of pictures in one go, and it makes a three-dimensional view of the breast, and we can page through the breast to see the tissue much better. Before you even contemplate doing a mammogram, girls have to examine themselves on a monthly basis, and then you check for any changes in the breast, dimples in the skin, pulling, puckering of the skin, pulling inside, internal inversion of the nipple, lumps as well, redness, swelling. Anything that's new, that's changed, is important. Then we need to have another look. Like everything, the first time is always the most difficult, and the mammogram is actually done by women, so I don't really have to be in the area where they're exposed. But if we do need to actually examine the breast, a little bit of a joke or two just to break the ice, the mammographer will place the breast on a film plate, and there will be a very slight compression. In the olden days, we had to compress it about 2 centimeters. Now it's 5-6 centimeters, which is just touching. It's not compression. And then the machine will take a series of about 15 photos running around the breast. The whole process, the breast wouldn't be compressed for more than a few seconds. From beginning to end, it's about 5 to 10 minutes in all.
Come right into the machine. Turn your right ear against the machine with me. Okay. So I'm going to go down slow with the compression, and you can stop as soon as you feel too uncomfortable. So right so far? Fine. Alright. Please keep that position. I'm going to do the exposure. Okay. How was that?
Fine.
Okay, good.
It was better than I thought.
Okay, you
I thought I was going to be sore.
No, it's not.
Yeah, this is just an estimate. It's not 100% accurate, but it gives a good idea to explain to a patient what to expect. So the first 3 years of a cancer growth, it ends up to still be very small. So about the size of a pinhead after 3 years growth, and we tend to miss those. But if you come annually for your mammogram, by the time it's the size of a pea, we're going to pick it up. And when it's that size, it's still early enough for us to cure the cancer. Anything under 2 centimeters got a good cure rate. On the 5th year, it's about the size of an olive, which is about 2 centimeters, but you do have spread by that time. The risk when you're a young lady is very low. Then it starts going up as your hormones, your cycle kicks in. And at about the age of 40, it's high enough for us to start with screening. It does go up at about the age of 60, 65. It peaks, and then it comes down a little bit, and then it sort of plateaus out. At the age of 40, internationally, we start with screening. The incidence of breast cancer is high enough to make it financially viable to do regular yearly screening. Incidence, men versus women, is about 1 to 100. In other words, for every 100 breast cancers we pick up in female patients, we pick up 1 cancer in male patients. It's less because they've got less glands, they don't have the high levels of estrogen that you guys have, but they still do have a risk.
So I've just completed my 2nd mammogram ever. I haven't done it for a very long time, which is very naughty of me. But as I get closer to 40, I know it's very important to do that more often. A lot has changed in the mammogram process from what I remember the first time, and indeed from my mother's time. The technology that they use and the innovation that they've brought into the process is amazing. The 3D machine is absolutely amazing. There's a little bit of uncomfortableness when they have to screen the side of the breast, but that's just uncomfortable. It's not painful, which I was very thankful for, because back in the olden days, like my mother's era, they'd often speak about the enormous pain they'd have to go through because the breast flesh would have to be pressed to about less than 2 centimeters. So you can just, ladies, you can tell me that would be quite painful. And luckily for me, it was good news. And I will be back next year, and we'll keep going back to make sure that my breasts and I remain healthy.